Shoulder replacement. Introduction.
Can you point to the cartilage?
Choose one of the following options.
Correct. The cartilage is a shock-absorbing, smooth material that allows smooth, painless shoulder movement. Which shoulder joint is damaged or diseased?
Choose one of the following options.
Correct. The bone with the rough surface is the diseased shoulder joint. The surfaces of an undamaged bone joint are smooth. Are heart attacks and other anesthesia-related complications common during and after this operation?
Select yes or no.
Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Blood clots in the legs after an operation are harmless.
Select true or false.
Correct. Blood clots in the legs are very dangerous, even though they are unlikely to happen. The symptoms may include swelling of the leg, shortness of breath, and chest pain. Very rarely, however, a blood clot can go to the lungs and cause death without giving any other symptoms. Are infections very common after surgery?
Select yes or no.
Correct. Infections are very rare. Though rare, infections as well as bleeding and scarring may occur. It is impossible to injure the nerves and blood vessels going to the arm in this operation.
Select true or false.
Correct. It is very unlikely, but not impossible, to injure the nerves and blood vessels going to the arm in this surgery. Although these complications are rare, they can still happen.
The operation tends to be very successful.
Select true or false.
Correct. The operation is very successful. However, complications may happen. There is a very small chance you may experience more pain after the operation, and the symptoms may come back with time. Mechanical failure of the prosthesis is common.
Select true or false.
Correct. Mechanical failure of the prosthesis is rare in this surgery. However, if it happens, another operation may be needed. Although these risks are rare, they can still happen.
Thank you for using Explain.